All right. Hello, hello. For those of you guys that can see me, and just setting up the show. And as I set things up,
Hello, Adam.
good to see you, Mark. Hello, hello. How are
Oh,
you doing?
we
And
try the best. We
yes,
try the best.
yes. And sorry if you guys are hearing noise. I'm not sure what they're celebrating in Mexico today, but there's some fireworks happening right at the moment. So no one's getting shot.
What is a firework?
Fireworks. I don't know how.
Because of what? Because of what?
Some celebration. There's always a
You
celebration.
don't know what.
No,
Okay.
And how do you say, cómo se dice fireworks in español?
Sí, sí, sí. Fuego de
Fuegos
artificio. Sí,
artificiales.
sí, sí, sí. Sí. Okay.
And there's always some celebration in Mexico.
Hello,
They love
Living
to do that.
University.
All
They
right.
love to do that in Christmas time. I don't know why.
Yeah. It's
Okay.
yeah, I support celebrating, although the dogs aren't always very happy about it, right?
Okay.
No.
All right, I'm going to pin us for the recording purposes, you and Anna.
Do you give me the co-host?
I can do that, yes, sir.
Okay.
And we'll do real quick. I'll pin you guys. I'm going to introduce Anna real quick, and then Mark, she'll introduce you. So she's the director of the university, and everything is recording. Everything is excellent. Okay. So, and time. What do you think, Anna? We get 2 more minutes before it's officially time.
Yes. Being
So,
punctual is starting at the time, not before.
Uh, okay. Then after you give me the co-host, Adam.
yes. There. Hold on a
No,
second.
you know how to do it, no?
Should say that.
So
Of course, here's Josh who needs the link.
it's like Swiss time, 2 minutes, huh?
2 minutes. Yes, two
Yeah.
minutes.
Almost there.
And let me send the link to Josh. This is how organized we are on our side, right? Anna, you can hear everything okay?
Yeah,
All
everything is
right.
okay at this side. We are going to do like a presentation first, and then we will take some questions. So I appreciate if the chat is more or less quiet. If you write down something, it's just questions that we will take later, because otherwise we have like parallel conversations.
Yes, what we did, we can talk about it just for a moment or so as people still start to show up. Um, the idea with this conversation, with Josh and I, we're excited. We're learning new things, which is great. We learned a lot from our father. We learned about a lot of great people, and we learned about this much about each of those people. So, Dr. Hamer was one of those people. And it's very interesting also as Josh and I do different presentations and we're online doing different podcasts. We've watered down our lecture because it's so long and we want to include a little bit on everybody. The little bit we say about Dr. Hammer these days is interesting with conflict shock. Almost every time we say something, someone comes up afterwards and tells us we're wrong. So we like to get to a
I
source.
will try to not to just confess you.
Well, and I don't, I'd said to Josh once that we did this at the Weston Price event, and it's interesting. New German medicine community typically comes towards us, and they don't have questions; they have comments. And I want to learn, I want to understand, and I don't want to take Dr. Hammer out of our presentation because I want to acknowledge him as a part of what made sense with our father seeing the big picture. So, with that being said, Anna came across Mark through another one of our University of Terrain teachers, professors. And for those of you that are new here today, as it's 12 o'clock, so we'll start the ball rolling officially. Those of you that are new, my name is Adam Bigelsen. I appreciate you coming today. This is a School of Health Bigelsen Academy event along with the Living University of Terrain. So I want to introduce Anna Maria Oliva. Some of you might know her as well. She is the director of the University of Terrain. And Anna, I'll let you introduce Mark, and then we'll let Mark do his thing.
Yes, perfect. So thank you, Adam. Yeah, we wanted to do this webinar to present in a very professional way um, the information about the 5 biological laws that Dr. Hamer started talking about with someone that really has a lot of experience, because it has also happened to me that every time I talk about Dr. Hamer or the new German medicine, it comes someone and says, you are wrong. You are saying it wrong. Hamer never said that. They say, okay, so I will have to ask someone. And here I'm seeing Alejandro Gatti Ali Al Hakim, who is one
Hola.
of our teachers. And he told me, I work with Mark Pfister and he knows a lot too. I consider that Alejandro knows a lot, but he introduced me to Mark. So now I'm going to introduce you to Mark.
You better speak well because he's very um, oh my words, no, let it go.
No worries.
My
I'm
English is
here
too good.
also, Mark, as people can see or hear. I'm Spaniard. I'm from Spain, so I can be your crutch or something like that. So if you don't find a word, just say that in Spanish, and I will try to translate that into English. Let's see if
That's
I can
super.
do that.
Okay,
So
okay.
I'm here also to support you with the language. So I'm going to present you. I have just discovered that you were born in Toronto, which I didn't know.
Yeah,
I
yeah.
thought you came from Europe, but it looks like you came from Canada. So yeah,
My my parents are Swiss, and they
uh,
went there, and then
you were born there
I
and then you
came
came
out
back.
there. Okay, okay.
Okay, so he's been working in health since 1982. And in 1989, he became aware of the 5 biological laws from Dr. Hamer. And he started working directly with him, accompanying him during his consultations with patients, and beginning his collaboration with him in disseminating also these discoveries. So he's been doing the translation of the most important works of Dr. Hamer. He has translated that into Italian. And then he's been training doctors and health practitioners, and he's been supporting people. He has a lot of acknowledgement from different associations in Europe. And now he's here to do an introduction of what really is the 5 biological laws, or what are the 5 biological laws, what is the new German medicine, who was Dr. Hamer, and taking us a little bit out of this confusion that we have, because yeah, most of the times some followers of Hamer are very dogmatic, and they tell us
And
that
and dangerous.
dangerous too. Okay. So all yours, Mark. Thank you for being here. Thank you for doing this effort. We know that English is not your native language. He speaks a lot of languages, so sometimes the brain does like short circuits too.
Oh, I'm not used anymore.
So thank you for doing this effort of preparing the slides and preparing this presentation for us. And now it's all yours.
Okay. I'm thankful for you that you gave me this opportunity to explain and to put a little bit of light of this jungle we have of new medicine, Heilkunde, etc., etc. I apologize for I have my larynx in solution. I will cough a little bit because yesterday came two aggressive journalists. They wanted to come in my house and to make a lot of mess because this is really there's not a case, no, not a, that I, there's a boy, 14 years old, who died 2, 3 months ago, and they say because he's of Hammer, no, and so they came to, no, like mafia bastard, and so I had the the my territory was, no, in fair, and then after when they went and I put them to the hell, then I start to cough here because that's because I'm left-hander. No, so larynx is my territory fair, no? In the house. No? So that's the first beginning to say the biology is fair, is honest. There's no cheating with the biology. The biology is perfect. Okay, and we know exactly this different part which are in this knowledge. Then we have, in one side, we have an advantage in the sense that we have the possibility to understand all our symptoms. And the other side is the pity that we cannot tell us stories anymore. Because the biology tell us the truth, what we feel, not what we think. No? Good. So okay, perfect. Benissimo. Okay. So I can.
We will be taking questions after the presentation. So any question you have, please, you can put it down in the chat, but we are not going to read it until we finish the presentation. So as we don't have a parallel conversation in the chat. Thank you.
Okay, and if we want, we can make a little break in between after the introduction to see a little bit what is the question pending, and so we look. Okay, the second, I'm just coming because I try my best with the technology, but I have. Okay. Okay, there we are. Okay, so condividi. Yes. Okay, fine. Okay. This slide, I made it in this last 13 hours.
We see your screen perfectly.
Okay, perfect. So I even copy your
Thank you, the logos.
Yes, thank you.
Thank you.
And there's the logos of our school and also from Alejandro Bioconsciente, Ser Bioconsciente. Okay, so I have to, I tell you 2-3 things important about Dr. Hamer. He was graduate a physician and graduate in physics and theology. And he was very, very sharp to distinguish what is scientific and all these assumption beliefs, etc. No, and this what is scientific is observable. We can make a supposition. We can verify, or if it's not verified, we refute. We can reproduce. We can predict. If that is not, it's not science. Okay, and we have all these beliefs about bad cells, about malignant cells. We will see it later, and about microbes that makes illness and the immune system and all this. That's all beliefs. They are not scientific. They don't have this very tough precision. And almost we have also in the diagnostic, malignant and benignant. This is religion. This has nothing to do with an accurate observation in biology. nothing. There's nothing good or bad in biology. All is purposely for something, no? And when we are clear with that, then we can go further. I'm grateful, no, because I shared this 30 years, no, as Anna said. I was next to him. I translated these books in Italian. I was next to him also sometimes when he made consultation with patients, no? And on the top, I was acting with himself to optimize and upgrade the synoptic table. That's the I don't know if you know this is a table which for every symptom is what is the tissue and what is the brain area which is involved, and what is happening in active phase for this tissue, what is happening in solution, what is and then of the scare, what the scare, rest scare, and so this double, and also about following from this table, there's also cranial nerve table. I was there with him, and just to tell you a little anecdote, we was putting together piece for piece this table of the cranial nerves, and we had 15 books of embryology on the table, and we made piece for piece, and every time was moment. How can we verify that? How can we look this is not otherwise? It's all the time this strict attitude of scientific investigator, and I was very glad because this is what I learned basically from him. Not one word is said that not can be verified, no? And that's this an attitude which is very, very seldom in the scientific world, no? And we have also the director of British Medical Journal of Science. They say 2, 3, maximum 4% of the scientific articles, ¿cómo se dice?
Articles.
Yeah, articles, yeah, okay.
Mhm.
Article, they have verified dates. All the rest is blah, 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 no? And that is a little bit, I'm very glad for this. And when we talk about Hamer, not just to make pleasure to Adam. No?
Thank you.
You know, the people, they are mostly childish, no? And they want the guru. They want the guru, not the Superman. And that's maybe in a further class when we are a little bit more in, but I'm left-handed and I'm not submitted to the hierarchy. So I was open to him, and I said to him the things when I was thinking, and the right hand they stay under, no? And so there was this Dr. Hamer, no? But I was next to him, and I saw him as strictly scientific investigator, and at the same time as a human, no? If his bloody things, with his stupid things, no? And all these bloody things about Jewish and not Jewish, no? And I say, get what hell you say? You cannot say the Jewish, no? The Jewish, a Jewish is because his mother is Jewish. No, it's a family story. No, and you cannot say the Jews do. Yeah, we can say that three fifths of the world power, especially in the big pharma, these are Jewish families. Yeah, that's true, but that's not the Jewish. And even he was attending Jewish people. They was making cameo. He was saying bloody shit in the all the time. No, and I was the only one who said, "Hey, you are no okay." So I learned him as human. Like me, I can have a big knowledge in all that. This is 36 years. I every day I go look and put in doubt and go ahead and investigate it. But I'm also human. I'm also stupid. No, I also no. So this emblem from Dr. Hamer. No, okay. I like him very much. I have it in my heart because I was near to him. And but this guru, this meaning to taking as guru, this reduced the fact that the people begin to think with their own head. In all this year, and he has discovered 4 laws. 4 laws that I have verified in each detail. The 5th law is when he was getting old and he get philosophically, and he said the sense of the illness. No, and this is so easy for the simple people. The illness is a good thing. The nature is good, and so and they have made a little enormous mess for this. No? In reality, the 5th law, which says that the illness is a process that has a sense for the biology, for the survival, etc., is very, very nice. I can only verify it for the old brain, for the palencephalon. I cannot verify it for the new encephalon. That is a sense in the no. When you have a prostata, because I cannot make descendant, no. So my prostata makes more sperma liquid that I can fecund better, easily fecundated. Or when something is wrong with the child or with the partner in the house and the woman is giving milk, they will have more milk. We can say there is a sense, but that it's an ulcer in the coronary artery that has sense. That is no sense, no, okay, because there's no verification. And when you think all this story about the wolf, no, the wolf chief, and now he lost his territory, and so then he make an ulceration of the inside of the coronary arterial, no, and this Hamer said, "Oh, that's nice. Look, in a moment in which all the body is making sympathicotony and vasoconstriction, reduce the veins, how to say, the veins and the artery, no? This is okay? Yeah, the vessel. They reduce the vessel. In this moment, the nature is so clever, they make an opening in the arteria, in the coronary artery. In reality, is there a little ulcer, there a little ulcer, that when they heal, they make a stenosis here and one there. There's nothing. We have, I don't know if it was too complicated, but it's that for the biological sense of the illness, please put it in the philosophy, not in the clinic. Okay, and I'm 36 years. I'm occupied to me for the clinic, for the precision of the clinic, and this is philosophy. But if somebody is sick and then they say, it's nice, the body is doing well, and then he go to hell, no, he go to the cemetery, no, because there is no knowledge about the urgency, and we have two urgency. One is the objective urgency. That means that in short time, with this what you have, then you can die. And when this is the case, then you go to emergency. Then you go to the hospital. This is all what the people of Neue Germanische Medizin, Heilkunde, they don't say. That's a loss of ethic, a loss of respect of the human being.
So, Mark, real quick, just to interrupt, I think this is to clarify the idea that my dad would say when people are having their cancer, if you've got something growing out of the side of your neck impeding an air passageway, you can't just resolve the conflict and this is going to go away. There's a biological component. So if you're having something emergency-wise, as opposed to just saying, yo, beautiful, the body is doing its thing, isn't this wonderful? There is a time where you have to intervene with that. Is that correct? Is that what you're saying?
Exactly.
Yes.
There is no rule. In each case, you have to see, but you have to be awakened, and look how is. But you have also to have, and that is also a problem from all this new medicine, that almost they don't have a really knowledge about anatomy, physiology, about they don't know really what is happening. That's because Dr. Hamer, he had it, but this and these people make philosophy and then bring the people out of sense. And this is, I know it seems a little bit polemic, but I tell you this with a big sadness, because I have seen in all this year the various disaster made of this superficial, this easy way to talk. That's why the first thing is to clear one, that the five biological laws, they are not a medicine or a therapy. They are a detailed map, diagnostic map, that you can investigate exactly, empirically, verifiably what is happening in your body. And that is, and here, remember that a map, it's not the territory. I mean, if I have a map from the roads, I go from here there, or I have a map with all the high level and the little, each are all are mapped from USA or from Mexico, but nobody from they are not the territory of Mexico. That's why we have always this map. This gives our direction, but we have to verify in the person say, and there is also no protocols.
We like that. Everyone's unique, right?
Yeah, but we will see also why, But the person is unique in the way she feels, in the way she take over what is happening in her life. And we have also to see in the body what is in this body happening. So we have to have a knowledge which is important. And this five biological as an overminded terminated method. It has how do you say that over determined. See, over the method. I apologize for my English is very bad. Okay. That means that when I have even uh, desfrío, ¿cómo se dice desfrío?
Cold.
Cold, no. There is a tissue, there is in which in phase it happens when it's stuck, when it's cooling. And I have the brain area which is involved. I have the feeling what this person had, no, the meaning of the feeling of this person who feel that, no, this alert of the future, no. So I know many things, and all these different parts, they have to be congruent, convergent, no. Otherwise, I have made a bad work, and that's when we really know this this correspondence between the different parts. Then we can also see when we are out of the road, when we are, we have make a mistake, because all this part has to be together in the same time, no? And the problem here in the science, no, is also that what we cannot is not measurable in quantity doesn't exist, no? And the, the psychic, the emotional level, we cannot measure it in the, no, in one way. We can just each time with a delicate and also with competences to be able to hear really what is happening in the heart, in the body, in the womb, in the inside of this person, no? And then we can see what is happening. But that is not measurable, no? In this, we will see that there is two parts. We have one part is, I say, the five biological laws are the anillo ring, the ring between the heaven and the material, no? Because the heaven, I mean, all what is the story of the person, all what she has experimented, all what she has heard, what is told her, all his biography. This is all the heaven, no? And when happens something, it goes in this meaning or in this meaning in basis of what is the story of this person. And that is aleatorio, because it's
Random.
can see very random, no? Okay. But when once I have, like me, I have the territory which is en peligro,
Danger.
in danger, then I
Threatened.
react when I feel that my territory in danger, then I react. When I right hand with the bronchus, no, and if I left hand with the larynx, I react with that. And that is from there on, from the feeling of the person had, from there is 100% verifiable. There you can see exactly every part. But why one person in front of an event break down and the other is quiet, that is his story, no? Okay.
Mm-hmm.
And Hamer has discovered different sort of things, yeah? And something he has performed and clarified inside the current knowledge of medicine, the medical knowledge, has made precision. And other things he has discovered only by himself. No? And that is this essential knowledge is the how the impact, emotional impact activate, no, our process. Also, and there we have also much studies about no, Candace Beth or others. They have seen many things, but this precision from this, how it happens, that is from Hamer. And also in the Bifazi curve, this was there, Seyle and others was talking about that. But this precision with the epileptic crease and all the timing, and so this is from Hamer, no? And also the embryonic development is known, yeah. But when we know how each tissue is working, he's doing, then he has made more precision in this. And I told you, it was with 15 embryologic books, and they wasn't tell the same thing. Something with a bit that, with a bit that, but without really knowing, no, the how it's moving the tissue, how is behaving this tissue, and then I can know exactly what is happening. And also, in this sense, he has made these brain maps, no, the maps of relay, no, of the innervation of which tissue are no innervated, and this he made it in the beginning, especially with the looking about the brain's scan, no, brain CT scan. This brain CT scan is only a photo in the moment, and it shows you maybe when something happened before, but it don't say how it goes on. And the brain scan is only one of the 103 elements that for each symptom you can investigate.
So let's come back to this. You're saying that the CT scan, that is one of the things that people are over-focusing with. They talk about, Hamer is always about the CT scan. You say that is just one of the 103 things you check?
Yeah, you have 4 tissue, you have 5 phases in the SBS. You have all the different things. When we put this together, 103. Okay. He put this also in a book, Hamer, in a book of.
I think this slide is very honest, because you are saying Dr. Hamer was not the only one talking about the emotional impact, that how the emotions impact biology. You were saying Seyle and other authors have been also, Gabor Mate have been talking a lot about the physiology of the trauma. So there are some things that Hamer was like going deeper in the knowledge, and other things that are just his work, like the symbiosis of microbes and the brain constellations. Mm-hmm.
And what he find, only he. This is the third law. Mm-hmm. You will see it after. That shows exactly nobody before him has discovered that the old brain, cerebellum and a stem brain, that when the tissue which are directed from this area, from the palencephalon, they work in a way, and the neoencephalocortex and medulla in another way. That's the only one. And even this is the Nobel Prize from the 1,000 years, no? And it's so clearly, so easy to verify. It's so clear there, and it's since 50 years now, and nobody has taken really this challenge to use it, no? Okay, and this is the big discovery he has made. And the other things, what you told before, is that with the different brain area with our Shivasa, we have also an a change of behavior, no? And this and all what we have this DSM, no, this big book from the psychiatric no observations. They are all observations without one single etiology. Etiology? How do you say? See? You say etiologia. The origin, without knowing the origin of a compulsive or aggressive or what this is, or no, they don't know from where it comes. They have all observation and they make therapies over that, no, in good meaning, but they don't know the origin, no, and that is from him. Okay, so before we enter in the material, I wanted to make a little stop and show if no, also look if there are questions about this first thing I said, no, because I would like that it is there is peace in it, no, okay.
Sure, and I appreciate Anna you helping clarify a little bit. Mark, like I said, for us, for Josh and I, we know a little bit about the five biological laws. It's nice to know, though, that what Hamer did was build upon some things that had already been acknowledged, that he didn't just come out of nowhere. So that's really nice to see. I appreciate the clarification and where he took things to another level. The idea, too, that there's more going on than just identifying the conflict, the biological aspect that we talked about previously. Yeah, I think that's been a big question. You know, we did have, and for those of you guys listening and watching, we had questions come in ahead of time, and we sent some questions towards Mark so he could be prepared for some of this. There's so many times the idea of New German medicine, I think at least, saying you identify the conflict and then all is well. But like you said, and even like my dad talked about, there are certain times biologically, that's a big piece of the puzzle to identify and understand that. But the biological component. And Anna, too, if you've got questions, you can jump in and add them.
No, I think
Go ahead.
it was for me, has been very interesting to see that, yes, there is a part of the work that you can trace to the minimum level. I mean, when you talk about biology and you see the symptoms and you can track that and you can see how biology is just reflecting exactly what is going on in you. This is measurable. This is a law. This is something that always happens in the same way. Now, there is another part that is absolutely subjective. That is how you
Exactly.
interpret the reality that makes you
Exactly.
have that
Exactly.
symptom. So this is, for me, is very important, because otherwise we go into the biodecodification or the neuroemotion, whatever,
I will come now to the impact. I will tell all
Okay.
about that. Yeah?
Okay.
Okay.
Awesome. Awesome.
Just wanted to say, no, the fact Hamer is a little bit like Mendelssohn, no? He has made the table of the atoms, no, of the different
Mendeleev,
atoms,
yes.
no, okay. But after they came and they discovered other groups, no, it was Mark. The problem is that he had really a big necessity to be approved, to be seen, and that made that then he has make the fifth law, no, the sense of that, and then neue Medizin, and then neue germanische Medizin, and then die
New
Heilkunde, no,
German
okay.
medicine.
Esther, this is politics. I don't discuss this. This politics has nothing to do with an awakened handling of the sickness from somebody. No.
Yeah,
Okay.
that's
That's
good.
why I don't talk since years, I don't talk anymore from Neue Medizin, only 5 biological laws, book, no?
Nice.
Nothing more. And is a medical knowledge, a medical scientific knowledge, which not is a therapy, is not a therapy, but is an instrument which, for the single person who is ill, can maybe understand a little bit, no, slowly, no, by growing. What you tell Anna, that you know you have the feedback of what you really are, how you really are
Right.
confronting yourself with the reality, and that is one.
And this is
But
very important, Mark, because many people out there, they talk about the new German medicine that you don't want to talk about. And I know that, but they talk about that medicine as if it was a therapy too. But this is a very precise
no, that is very,
diagnostic.
very dangerous. This attitude is very dangerous. No?
Okay, so we
And
have the
and
5
the
biological
scientific,
laws
yeah.
that is a very precise diagnostic method that allows
Right.
us to see what is happening and how did we get there, because it allows us to know ourselves, to see how are we reacting, to see, for you, for example, to understand that you were feeling threatened in your territory. So by seeing the symptom, you can go to your consciousness and realize what are your beliefs and your interpretation of the reality.
You talk and I cough. No, that's biology. You bring me back to this scene.
Ah,
So that this, and I cough. This
sorry.
is the precision of the biology. That is nothing more. Okay.
Yeah. Yeah.
Oh, I want to say the second thing. One is, okay, I can know for myself what is happening, going on. But how, for the professional, for the physician, for the therapist, for the psychologist, all, when they know this really, they make their job much better, much clearer, much precise.
Mhm.
Yes.
Precise.
Without
And that's
question.
not that, and a doctor is a doctor. He has a certain level of work to do. But if he knows how it's happened, he will have less afraidness, no, about the illness. He will communicate this to the patient, and there are many studies, Benedetti in Italy and others, no, which have demonstrated that 65% is placebo effect. And we will see that the placebo effect is really is a part of the brain, is a hypothalamus activation. And when I'm afraid, I have the feeling they have no issue, no salida, no issue, sí, no,
There's no exit.
no exit, no. Uh, then I activated this, and I have much more pain, much more difficult, all no. And if the doctor is afraid about the sickness, he will communicate it unconsciously. And the patient will be afraid, and he will have a bad exit.
Yes.
No?
Yes.
I mean, that's because I tell you the truth. Why do you think that with all this bloody mess of this world, I'm still hanging on after 36 years? That is why I my wish is that this knowledge is a word of peace. It's a message of peace, okay? And when the person can check exactly what is happening in the inside of herself and not in the brain, no, then she's also able to make several steps to come home, to get again to herself. That is my wish.
Yes. It's to me, it's awesome. And then I want you to get into the next part of your presentation. We talk about the terrain is all, and the emotional experience is a big important part. And the idea that we can understand the patterns and progressions that have brought us to this moment of dis-ease. When Dad worked with people, the education was important. It wasn't about just fixing somebody. But then the idea too of understanding how you got there. There is knowing, having the mind involved, and being able to react differently when traumatic events happen to us, understanding how we react and how that affects us physically. And also the idea of, and this I think is where Dr. Hamer differs a little bit from what I understand of New German medicine, is there can be emergency interventions. It's not about,
I will talk about that
okay,
again. Okay.
all
Now
right,
we make a little bit entry of the material, and then we talk also of that. But
perfect.
I tell you, this is the 99% that we have. We know how to manage objective urgency, that is hospital. Subjective urgency is also to take care maximum, because we have this axe, this three level: hypothalamus, middle, suprarenal, medular.
Adrenal.
There's the anatomy.
Where is produced adrenaline.
Yeah, the adrenal
Medular
glands.
is, I beg your pardon, I have no terms.
All good.
Over the kidney is the never,
Yeah.
over the kidney.
The
They
adrenal
produce,
glands. Mm-hmm.
yeah, they produce adrenaline. This, and then the fact that when we feel lost without help, then we make also water retention with the collector tubules of the kidney. These three, when we are afraid, they make a mess. That's why we have to take very care for the person. Even she has a little note, a little swelling, to see how much she's afraid. Because if she's afraid, if she's in alert, she will activate many other programs. And the most of the people, they die not for little two, three cells were growing in the breast. No, for all the rest. No. And I was talking with an oncologist, no, who he had made 30 years oncologist, and he went away. He do only hypothermia and but other things and so. And I was talking. He was a good guy, and talking. I said, "Yeah, okay. People, they die maybe a little bit because of the chemio, little bit because of irradiation, but almost they die of fear." No,
That's, yeah,
that's why this message of peace is really no to slow down this subjective energy, urgency,
that's, I
and
want to,
only I
go
finished.
ahead.
I
Yeah,
finished.
sure.
And only when I have under control the objective urgency and the subjective urgency, then I can go and look what is happened, where is do you bump your head on which mower? Then okay. But these people who, when you have even heavy um, effect in the body, and then you have the conflict of as it
That was awesome.
huh?
Yes. So I think this is so important, Marcus. I want to just support this and then let you go some more. When Dad worked with clients, when we look at the blood, one of the biggest, most important things Josh would always say is there's no fear in what we do and what we see and what we say. And when the person understands how they got to where they're at and it makes sense, there's a lot less fear involved. And then they can get back to where they need to be. So I think that's great. There is no fear when we look in the blood these days. Everything is the body trying to support. And if we can understand, then we can be in a better spot. So I appreciate you saying that.
Okay, let's go.
Let's go.
So, first of all, you see me, yeah? Yeah?
Yes.
Okay.
Yes, yes.
Okay. Because it's not going. Come on. Okay, now, moment. So it was blocked.
Okay.
The joys of technology.
Yeah, the joy of moment. Okay. So the emotional impact. It's very important that we have since 150 years important studies about psychosomatic. In reality, it's a schizophrenic feeling, no? Because there's a psyche, no, and the body. In reality, what come out when we know the biology, that all this level, they go in the same time. They are all what I feel, and the body is much uh, more rapid, no?
Quick.
Then what I understand, I have wet hands before that I feel that I'm fair. No, I have the breath blocked because I have blocked the diaphragm. No, before that I feel that I cannot leave, I cannot stay. No, I mean that goes all together. And what he told the DHS. Okay, I will say a little thing about the communication. I please to apologize that Hamer was a doctor. And all this study is white and black. And so he had also communicated all this knowledge he took in black and white. And this DHS, Dirk Hamer syndrome, he had told us because this story with his son, which was shot for the Prince of Italy, and then he died after 3 months. And after three
And it's
months,
very
when he
important
died,
to understand.
when he died, then
Epic
he had
activations.
the testicle,
Testicle.
the testicle who swelled, no, and then he started all this search, no, for years on uh, 100 from cities and all. Yes, I was with him. I see that. Okay, but the fact is that we have our impact to activate. When we have an impact, this activation is not because of conflict. I always say the same thing, but it's very easy. When in London there was bombs coming down, in the Second War, there was one was in a corner like that, and the other was going helping the who was under the houses and so it is not the conflict, it is the way I react about this, and this reaction is when it's not the perception we have, but it's the meaning that I give at this perception. No, I make it always in this easy example when we hear a tree looking out of the window, and the house the next is burning down, and then I can say, "Oh, look, that's good. That there's more sunshine," and the other say, "Shit, my cat go always there he will." No, we have seen the same thing, but we will react completely different. No, or you will see it after when when you see your wife in the bed with another one, no, you can make 15 activation or say, now I can divorce. Okay. No, it
Awesome.
depends. No, it depends. What is your story? That's why for the same event, for the same conflict, you don't have an activation. And when do we this activation? We do this in the mother womb. We have a noise, a strong noise. We want to go escape, but we cannot. Then we make the motoric. Mama is sad or angry. She closed the vessels, and I have less to eat or less oxygen. No, when I'm there in my terms, 40 degrees terms, swimming quietly, and now the all is the paredes, yeah, okay.
Wall.
The walls are compressing me. I die. I come out. They gave me a kick. We put a pick inside. They put me on the balance. They put me with a hard thing in a bed alone with other 15 poor people crying to hell, to death. But that have activated all. And when we activate it, we have an imprinting, okay? And I make for better this easy example with my son. He was when he was born, he had the hippo. Hippo is the
Hiccups.
hiccups. Had hiccups, and I gave him 2 drops of lemon, and hiccups were okay. And he said nothing. I say okay. Then he likes lemon. And so it was the first 2 months. At the end of the second month, he had a hiccup, and I give the lemon, and he say, why you do that? You have always talked the lemon. Then I go, and the papillas for the acid, they ripe at 2 months, no? So he had this lemon, this acid inside, and we will see it after shortly, but this acid, and so activated the brainstem, which directed the glands, the saliva.
Saliva. Mm-hmm.
Okay, and because it's from the old brain, we have a plus and function. We have more this. How do you say saliva?
Saliva.
Saliva. Okay, more saliva, and you balance a little bit this acid. But he don't remember Papa who giving the drops. But all the life he will remember the sense of the lemon in your mouth. And we say, when you think only to bite into sort of sour lemon, you feel it's coming water in the mouth. No? Okay. Because the first imprinting and then the whole life, all what is similar or what remember you that, activate immediately your biology. That's why it's a fault to say you have a DIS in 5, 10, 20, 90 years. No. We have activated all our areas in the first, in the womb and in the first living year, maximum second year. They're all activated. No? And there is no conflict on, conflict out. No. We are constantly in remembering, in similarity, we are constantly activated. And that means that we are like a little ship in sea with the wind and the waves, no? And try always to keep over water, but we are continually actually. You go with the car to come out, one out. Oh, shite! How many things in the days we activate? 10,000. No, okay, and that that impact which comes so unexpected. It's not that DIS that you have done, but that remembers you. You feel again what you feel before. Here, the football player who see the cat and want to give a shot, and he blocked his movement. Okay, because you don't want to kill the cat, but this movement who is blocked, remember him when he was tied in his cuna, in his how do you say the bed for the baby? How do you say?
I don't know. It's
Oh,
the
like
bed of the babies.
a crib.
La cuna.
Crib. We say a crib.
La crib, see, like, oh, it was tied, and no, when you are blocked, you wanted to go, and nobody comes, you are blocked. No, okay, that's not. Then you have yet now this block of the movement, no, and this make the motoric area activated, and when you relax, then you have the leg is a little bit flaccid, flaccid, yeah, no, so
Yeah, like weaker.
weaker, yeah, okay. And then in the epicresis, you have the tonic clonic. Then they say you are epileptic. Okay, that is the happening when something happening which is unexpected. Then we react as we reacted in the first 2 years.
Yeah,
And
so
this is
when all the
our
programs that
limit.
all the programs that we have been created in the first year, 2 years of our childhood,
Oh.
and the rest is just repeating those patterns, because every time we interpret the reality, we come back to that first interpretation that we had. So we are just repeating and repeating the same.
And that is, yeah,
perception.
exactly. And you have this. That's why I talk about unexpected, no?
Mhm.
When now this journalist came, no, I was opening the door to make a little bit air. Professor, and they came with violence, and no, and one was filming behind, and no, and okay, then I get over, and I tell them, you are bullshit, you are without respect, go in hell, and no, and I close the door. After 5 minutes, I closed the door because he was pushing my door, no? Okay. But I go to check. I had this story in the past. I had a process, I have stories with journalists and all this, no? So clearly I go with that. But what is really tricking me is that I don't feel me in security in my house. And this is when I was little. Okay.
Yeah.
It's a little bit, you have to take time to make difference for this. But the basic feeling that we have now, then maybe it's a punctual situation with like the journalists, they are there and coming and aggressive and so on, no? Because in Switzerland, there was a campaign for 3 months, charlatan, Swiss charlatan, and so on, okay? And
like they were, calling him like a quacker or like quack.
yeah, like the Church Inquisition, how to say, no?
Like
Okay,
but
but okay, I hold on, I go on, and so on. No? That was in 2000, in 2000. This is 16. No? Okay. But and before in 2007 they came investigator in the no, where it was in our place, in our house, and so on. Okay, all these things, and I had 7 years of process, and anyway, no, and so I, when they now come, I react surely also of these things which I have lived, no, later on. But the feeling, the biological feeling, is that I feel that they are invading me, no, and that I'm not sure in my house, no, and that is the little boy, no, when Papa, Mama are fighting, no,
Yeah,
like, what can
this
you
is the
do?
memory. So whatever is happening is coming back to the memory of the feeling, not the fact itself, not the fact that there is a
Exactly,
journalist trying
exactly,
to kick you. Is the feeling that it produces on you about I'm not safe in my own home. And this is
mm,
what is coming back and again.
exactly. And if I make new medicine, you have your territory in danger. See, that is true, but the real feeling is that I go back. It was so little, no? And
Mhm.
that's it's not so easy, because when we want conflict on conflict result, so or black and white, but it's not the truth of the how the person with these 1,000 antennas is acting every day. So we have to have also, that is also another part of where which are in our training school, we are very focusing to have the competence to really enter in listening the person, and not what I think it is, no.
Yeah.
And that's right. And when it happened, then we have this impact. These are all scan photos which we can see still, this nice, no, uh, figure there, here or here, no, like and this is
Ripples. Mhm.
yeah, okay, exactly, no. And but I say it here, no, attention. These are only imagined in the moment. Okay. Then when, for instance, here, that is the sensoric uh, cortex, and it's really central. And this woman, she had she was separating her from her second husband. And when she told this to her mama, the mama was aggressive, and she threw it out of the house, and she couldn't go for 10 years in the house. And uh, there was a contact, sensoris contact, but with afraidness, no? And she, in the beginning, with this bill, she couldn't even make a shower, because only the water going on the skin was aching her, no? Okay, she was completely, no, in this, but this part. And this the same brain, on the right side. Here is the post-sensoric, where the feet are. Okay, and we all always, for much much simplicity, we put always the CT scan, that the right side is right and the left is left. When you see normal CT scan is reverse, no? But otherwise it's too complicated. That means that this is the right side of the brain, and here in the right side, in the middle, of the two cortex, there is the point of the activation. No? That means that this for the left feet. No? And this girl, she was 19 years old, and there was also a group. They were they make Kuzmin for the multiple sclerosis, blah blah blah. No? So, and they brought a little bit like a challenge, no? What you see here, no? And I saw this white, no? These are scars, eh? No, they're not scars, but the scars in the medulla. Hmm? That they say, okay, they told you you have multiple sclerosis. How do you say in English?
Well, that's it, multiple sclerosis.
No? But in reality, you have il gelone. Gelone is when it's freezing your feet. Your left feet freeze when it's cold, you get uh, uh, congelate,
Frozen.
frozen, exactly. Frozen. And she said, how do you say that? And it's there to see. And since when do you have this feet which is frozen when it's cold outside? Then, because this is the post-sensoric, and this is also a brain part which Hamer find, which before in medicine we didn't know really what is used this post-sensoric cortex, and this is for this in the first weeks is a little skin, then is only an innervation for the periost. Okay, and we activated the periost makes a vessel constriction, so the blood goes slower, and when it's cold, they can frozen. Okay, and so I said, okay, and that is and this periost activated himself with the feeling that there's an separation with pain, that you are hidden, go away, no path. Okay, and the feet, no. And so I asked how, she say for 4 years. That means that she was nearly 15, 14 and a half when it started this symptom. She was there with her. She is left-handed. That means that the left side of his body is in relation of somebody who is like the same level. That's the partner or the papa or the brother, no? And the other part is for mama or for children and so on. So I said, you have this partner since when? We are lovers since 1 year, but this is my first love. Okay. Okay, they say, okay, then I know it's Papa. Then what is happening with Papa? I don't talk with him. Yeah, but since when? Since I was 14, I went from how back. I was nearly 50. I went away. They okay, but what has happened when you went away? You have a discussion. Yeah, no. And did your pa give you a hit with the feet? They know my father have been never touched me. Okay, they say, yeah, then he has give a shot at something, and then she get blocked, white. Say, yeah, he has get a shot to a little tabouret, little
Furniture or a
yeah,
stool.
yeah, and he went to the wall and he break a piece of wall. But then I said to her, yeah, but this hit, to when, to who was it directed? And with an
Yeah.
lacrima, was his lacrima?
The tears.
Tear.
With tears, she said to me, okay. And then she went. Since 4 years, she go a little bit and she go away because she goes see mama, but she don't talk with papa. And then she leave away. So that is why here you see there are already, this white is already some glia uh, scar, no? Okay. And it's always, no? Ida vuelta, go and let it go, no? Okay. To say, Claire, this is an instrument, but it's one instrument. You have to know it very well. You have to know all the brain, no, conformation, so, and then you can go directly to the point. But that is only one. If she would have tell me that she has frozen the feet, I don't have to see a scan. I know what is happening, and I can go the same way to bring her to feel what is was. Oh,
And this topic of the CT scans is one of the topics that many people criticize. I think that we hyper-focus in these images. And so many people criticize because they say, oh, they are just artifacts, or how can you demonstrate this? How many pictures have you taken? How much have you
this
done, like a double-blind study and all these things? I mean, this is very typical from these images because
listen. You know that I'm 36 years in this mess. No, I
yeah,
know.
I just want you to defend that accusation.
No. I don't defend. Artifact is when in all the brain image you have the same anesthesia ring, all the things. That's an artifact. And Hamer has also published that he was by Siemens, and I clarify that when there is 2 or 3 of them, it cannot be an artifact. The artifact is central, no, to the here. This you could say this could be an artifact, no, because it's only one. It's not true. There is another one. There is another one. There is another one. Here another one. Here another one. It's not true. No. Here you have this, no, but you have also here this part. Here also you see this here. Okay, I have many practice, but you see that there is a little white things here, no? And here you see it better. And this is on the right side. This is coronary artery, no? Arterius coronari, and no, that's the territory, no? And
for those that like that like numbers, for example, Mark, how many scans have you done to say that this is a pattern?
Again, how many scans?
How many scans have you done, or has Hamer done to say, okay, I found this once and again and again and again. So how many scans have been done proving that is happening always?
He had a big, how to say, cantina bajo de la casa.
Like a bar? Like a restaurant or a bar under the house?
No. You have the house, and under the house you have the
basement.
Basement. Okay, in the basement he had, I think there in Spain it was about 120 scanned, all with repertory where things studied, no? But before he had, they couldn't bring it from Germany. I mean, he has probably seen 300-400 scans. Every time verifying the code, no? Every all written, looked with his loop there, no? Okay, that is one thing. But I tell you, and the double blind, I had many it. Well, Anna. Okay.
I was gonna ask you too. You know, it's the same idea with our father with the microscope. There are images that Dad sees, and Western medicine and other people say they're artifacts. But the reality is, with the patterns over long periods of time, observing things is very interesting. When you show us the one scan and say the person's left leg was frozen. Well, David's here, he'll go do some homework, and David, freeze your left leg and we'll do the scan and see. But the reality is, Marcus, seeing patterns. You know, for us, Dad looked at a lot of different things at the same time, and it always showed the same thing. So when we saw these things in the blood, for people listening with us, we have tens of thousands of images of our blood. So over and over. And simply, you know, if you have a microscope and we see a broken arm in the blood, well, break your arm, find someone that just broke their arm and go look at their blood and see what you can see. We don't all have access to CT scan machines.
This blood showing is also a diagnostically map. That's not a therapy, it's a map.
Yeah.
To see what is happening. No, it's the same. Okay.
Yeah.
And the problem is that with this scan, he made it that to demonstrate it to the scientific world of the doctors that he's right. And so he asks scan over scan for everybody coming to him. Okay. And just to answer to Anna, I made double blind because there was a doctor who came in school for me 2 years, and then he was a little bit far, and sometimes he sent me a scan. Listen, this woman has at the breast, I think, can you tell me, is it lobular, is it ductal, what is this? No, so. And so I looked the scan, no, and I told him what I was seeing, yeah. But I took also this opportunity to say, yeah, but this person has this and this, and look, he has, and I know once he was very upset because I, with the constellation, said this must be the woman, the former of a guru, a priest, a guru, no, and chief, and she's the woman. Yeah, this is also. Oh, when I told him, yeah, okay, this is the breast, but she had this, and this, and then he said, I don't know. When she came back, the woman to him, he asked her what she's doing, so and so, and she was the woman of the chief of Opus Dei in Switzerland. Wow. Okay, but so I had many, and then he was a little bit nervous that I could find things which there's no, okay, just because I was looking.
No secrets.
And so I was like, yeah, but they had this and this, and she had a violence as child. She must have a violence, as child, and it was like that, and so no. And then one day came in his studio, and he showed me a CT scan with there in this part here, left and right, there was two puff, no, very strong, no. This is where is the thorax, no? Where is the thorax, and and I said, "Oh la la, this has to be one like that." And he said, "No, he's an old man, just like little. So it's just in the other room if you want to see him." It's not possible. Okay, show me. And I go in, opening the door, looking down, no? Poor little. And then come one man, 2 meters. Let him out!
That's funny.
And he was major in the Swiss army. No?
Wow.
Yeah.
So
major,
even
yeah.
if you know this clear, this is very nice. But what is happening with, and I'm very angry with that, the people has told this without really knowledge. They make oracle. And people, if you know exactly which emotion, which area, which tissue is working, what is the symptom, you don't need the CT.
Yeah.
Okay, if you're ignorant, you make. But the fact is that you go in a hospital, you make a CT, and they say, and then they see, certain scars or items or so. And then people, man, I have the cancer in the body, in the brain, and that I have seen all these years. No, yeah. There is one from this from Germany. He goes also in America Latina and probably in also in United States, who makes a lecture
reading
reading of CT and so. and they make really terrorism. No? So this is a knowledge, but it's not for the almost when I have one in coma, or when I have a dog, or a little child which cannot communicate, then is maybe the CT scan a good help. Okay?
Yeah.
No?
That's
But
interesting.
otherwise, no. And this, you know, Hamer has also his human problems, no? And the sex was all about sex and power of sex and so on. So that's why he told that when this left area from the brain, from the peninsular brain, and when it's activated, he says it's sexual frustration. Okay. But in reality, it's not sexual. It's that the, the child and then the woman or the man, in his feminine feeling, feel that the partner is not there, not present. No? Okay. And she is left-handed, this woman. That means that she makes this feeling the partner is not there on the right side. This one here, no? And this is the frustration with her part. That she has made many, because it's all full of glia. That means he has made many times. No? And so you see a story when you really, with respectfully purpose, you go and feel the person, no? Okay, and you can know something. But what you do with that, there is the difference. And I never look CT scan with the person next to me. Never.
That's
When
interesting.
it's happened, I look and okay, and then say how it is with that, how it is with that, and no, okay.
So this is an
Because
information that is useful for you to know more about the person, specifically if the person cannot explain certain things, but doesn't necessarily is useful for the person because they can go into the wrong place
The
with
rabbit
this
hole.
information. So what you want is to give the information that that is useful for the person, not just to demonstrate how much you know about reading CT scans. That is something that some people.
that is for all therapists. That is all for all therapists. No, when we
Yeah.
want to be performant, we don't see anymore the person in front of our. No, that's.
Yeah.
Yeah, that's interesting.
Hmm.
I was going to say
And
real quick.
when now this is more or less active phase with a bit recidive and so, but then it goes in solution. Then you have these edems, no? And that is very interesting. This I took from Hammer this picture because it's very interesting. No, you know that these two cortex are these two new encephalon are separated. No, and if there was an edem on the right side, it would push the middle line, but not a circle. That's because this activation has made in circle way, no? And now it's like it was burned, no? And now it's healing like when you burn and you make a bladder, no?
Mm-hmm.
Edema, no? And that's this, no? And here also this man has made, this is the where the urine is, la vejiga,
The urinary bladder.
the bladder, the urinary bladder, no? Okay. And here you see that this is without contrast, this is with contrast. And the contrast, because where it's, where it it has made glia cells. There are also many capillaries, and so the product goes more there, or no, goes more there, and so you see this is a scar. But in the same time, you see it here is an edema. That means he makes here, well, active and solution, active and solution. He had an impossible situation with a woman who was psychiatric with a child who was debilitated, and it was very difficult. He couldn't have his territory, no, and so. And when I saw this, I said, yeah, but you are always bleeding, no? When you are, sometimes your urine is full of blood, no? I said, yeah, but I don't want to make nothing, but yeah, but I saw this, no? Because I know what is happened, no? Okay. Clear, when I'm a professional, when I know about the clinic, I know about the things, this can be an helping hand, but uh, it's not purpose to say to show the CT scan and then to tell the people, no? Oh, look here, there you have that, and there you have that, and there you have that, etc. No? And a woman who had a similar situation like that, also central edema and so, and they came to a doctor who was also by Hamer, and so, and he said, Hamer would be very happy to see all the conflicts you have. And that is what they told you. They said it continue, you know. That's why I stopped this. Okay. Madre mia.
Oh my God.
No, I have
So,
I can talk about hours. Now it's 1.5 hours past. I want to finish this.
and just let me put another data here about this topic of the artifacts and these ripples that we can see in certain image, because there is another scientist that is called Björn Nordström, who was working at the Karolinska Institute in Sweden, who discovered also that with certain X-rays he could see some artifacts, they call them, like ripples in the lungs, that there were also showing that there was a cancer. So it's not the only person that has found artifacts that in fact they are very meaningful. And in fact, there is a whole science of the noise and the artifacts that are the real information, instead of what regular science dismiss, and they say that it's just noise or just artifacts. So for those that like science, you can Google Nordstrom and you will find similar things in other areas of the body that they also have a meaning, and that the mainstream medicine consider just artifacts.
Another thing is that when you make a scan, CT scan from the body, in the part which are compact organs like liver, like bones, etc., you see also the circle there. Okay, that's okay.
That's
But
interesting.
I say I don't read since years CT.
Oh, really?
Okay, I don't need. I really
That's
don't need.
that's something I was going to say real quick. When we talked to you initially, you can read the scans. You don't very often, because what you said to us was you don't need to because you understand how the biology works.
Yeah.
And what I said to you was funny. It's the same thing with Josh and I. We can talk to people, look at their history, and we can see very clearly the patterns that have brought them to this moment. But like in the hospital, until we charge people money and show them the blood, do they always believe us? So it's very interesting too, Anna. Something different here is to use these tools behind the scenes to understand so you can help your client. For us, this is part of how we help them, is by showing them that image, you know. But I think that part of the problem with this whole experience is people hyper focusing. You know, if there's one thing, okay, the CT scans, but that doesn't discredit this whole body experience.
And it is also, we cannot see all. We can see only certain things. We need many elements to verify, to see how it's going on. Okay? No? And
Yeah.
that's why the CT scan reading is oracle for selfish therapeutic.
Okay. What's that? What's that? Oracle? What's that word? I don't know that word.
Oracle. It's the oracle.
Oh, the oracle.
The
Okay.
oracle
Oracle,
for
oracle.
selfish for selfish practitioners. That it's like a crystal ball.
Right.
Suddenly
Right.
you see
Exactly,
the
exactly, no, exactly,
magic,
exactly,
Yeah.
the trick
exactly.
from the heads.
Well, and Dad
No?
always said you look at the blood, you look at the person. You look at the blood, you look at the person. You know, it's not about just looking at the blood. You
No,
talk about the
exactly, exactly.
person.
See.
Yeah.
This give me, well, I told you, I just stopped here because you asked me. Normally, I don't make all this talk about that, but you asked me because I know there, especially in the United States, they're all in England, they have put this CT scan over the rest, and they don't have really a knowledge about the anatomy, physiology, and just on this and now.
Yeah.
Yeah, but
And
for
the
me it was important, Mark, because many people are just not taking seriously the five biological laws and hammer work just because of some people not reading correctly these things, which I know that happens the same with the Bigelsen's, that their work has been dismissed just because there are other people using similar tools and doing totally different interpretations. So we need to put that on top of the table because this is a big problem. When people that don't have the proper preparation or they don't have the background they need and they just dare to do things or doing interpretations just to show, as you were saying, the oracle, like showing how much I know. And oh yeah, I exactly know what happened because you've been feeling this way, and it's kind of sometimes a big invasion too in your soul. It's like they are
dear,
sometimes
dear Anna, I love you, romantic. We can only do our little best. We can just make with heart and with knowledge and with respect what we do. Point. We cannot make that the others don't do blah blah blah. No, I just tell you this, but it's not my problem. My problem I make every day. Even this journalist came yesterday because of all this bloody shit. Oh, okay, but it's not my problem. I have nothing to do with that. No?
Yeah. I support that, Marcus. It's very interesting
I'm a
because
little bit frustrated because now it's many people listening, and I have made very few of what I wanted to do. No,
yeah, yeah.
but
Well, we have to meet people where they're at, you know, but for me, for Josh, we're not here to fight with people. We're here to present this information. And one of the things Dad would say is, look, if you know what you're doing, then results happen also. So, you know, with my dad's work, a lot of people got results that weren't getting results with anybody else. And part of it is by how we look at the body holistically, differently. Emotions are a big deal, the energy around us.
because yeah,
Well, and
I have
I was
I would have many things to say more, but I don't know how to manage.
as we can have you on another time. And
Yeah,
no pressure.
maybe.
No pressure.
I just let me just 5 minutes. I will just put 2, 3 slides. Okay,
Perfecto.
Yep.
just today for the direction, and then we make it this the next time. Huh?
Okay.
If you like.
Sí, por supuesto.
Allora. Uh, okay. Mm,
The epileptoid crisis. I have
it's
a
not.
few experiences with
Oh,
some
oh, oh.
practitioners about that.
No, I have not understand you. Please say it again.
That I have had some experiences with some practitioners that in front of an epileptoid crisis, they say, oh, they are clapping because, oh, so good. They are in this epileptoid, let's clap and just look at them. So yeah, so
Yeah,
please.
that's not, it's not what you do or what you say, is how. If the person is completely afraid because she lose her control, and you say, yeah, bravo, bravo, you are un assassino, which is an assassino.
A murderer.
You're a
Murderer.
murderer. Okay, psychically murdered, no? But if the person is regulated and no, see, this was this point of this moment, and that's no, it's going in front. But another thing which is completely uh, away from the reality is that this active phase and repairing phase, this is a monocyclic uh, way, no? But this is nearly it's animal. For we are human and we are so stupid that we don't follow the biology. We make not one and basta. We make all this, go and back, go and back, or I have resolved something and then still I think, I do, I no, and I take chronic things which an animal don't do. And then we are good, we are religious, we are good for the community, and we stay in impossible situation for years, no? Or then after years in an impossible situation, there comes a little thing which make me, no, fire, and then I say, go to the hell, fire mierda, no? And then I, and then I let go. No, I have a fight with my brother because he bloody started. Okay, for years, but it's my brother. I love him. We see us anyway, and so on and so. And then it happens that happened things with my father to go to the hospital, etc., etc. And I put me angry total, and then I say, vai alla mierda, vaffanculo, no?
Go to.
And then I
Fuck
had
you.
no, and then I had here 3 weeks, no, all I was yellow, no, all the white, the skin was yellow because I was in hepatitis, no.
Yeah,
Okay,
hepatitis.
but I say solution of the no that
The anger.
wrong thing done in my territory, no.
Mhm.
But when you was asking me the 3 4 years before, yeah, okay, he's like that, but I love him, and okay, no problem, no. But
Yeah.
I was just no, and that an animal don't do. If two dogs fight, he bite more, I go away. I bite more, he goes away and took another territory, and he don't come back the day after to see who is the chief. That's only the stupid human make. But we have the same code, biological code, but we use it dumbly.
Yeah.
When we to my friend Alejandro, son evoludos, no?
That's a joke in Argentinian Spanish.
Awesome.
Yeah. Is
Well,
that,
eso,
yeah, we have the same
that,
biological circuits that animals do, but we react in a way that we hold on so much shit, in his words, during so long, and
that,
then we just say that we are good people because of that, because we hold on and we hold on, and suddenly we explode and we create something that helps our system to heal what we've been doing repeatedly for years. And
no,
this is
that
something,
is not possible.
yeah,
And the nature don't aspect residues. I mean, that you make the same bloody thing, no? That you stay with a man who don't love you or a woman that don't love you for years. That doesn't exist. Okay, we can make it, okay, but not then we have a breast like that, or all things, no? The darm things, very heavy things, because we are just keeping. We are away from ourselves. We are away from listening to ourselves. No? But when I say, you have made a epicrasis. I say, moment, you don't know if Mike Recidives he has. You don't know nothing. Keep your mouth. Look what has happened. Look if it's an urgency, how to manage. If the objective, if not, what can we make that this person can make a step in direction of herself to make choices, to take strategies in her life which are more in harmony to herself. And this is but at the same time I look if there is you need to cut a piece of dharma, or because you have made so many things that you have made no many recidive and things, and you need to operate it. Okay.
Yeah.
No?
So
And this
that's
is
Then that is all. That's the third part, which is then the therapy. What we do with this knowledge. Okay.
well, and so the curves, just real quick. So then that's the single curve is the animals. Something happens to them, and they're there in
Yeah,
the moment.
a
And
little child or for little things for our things. Now I have to make a good. I've my wife invite five, six people to eat, and I have to cook, and I'm 2 days like that. Then I'm 2 days activated, and then one day I'm flat, the other day a little better, and then okay. But for little things, it happens also for us. But the most, not this is only for animals.
right. So, but we get stuck in a loop. We just keep bringing up this old, yeah. Okay.
Continue,
Right.
because we don't let go, and we don't listen to our real movement. No? Okay.
Let it
so
go.
then we have
That,
overlap of the phases. So we can have the two phases at the same time. And I love what you say, Mark, because I was a little bit tired of all these people that there is always like, if this happens to you, if you have this symptom, it's because this is what is happening, and that position of being a little bit more humble and knowing that you don't know anything about the person and just trying to do like another Sherlock Holmes, as the Biggelsens do too, like trying to understand what is really happening with the person. That is a totally different attitude of what we've been told sometimes by some people, that they are like, this is mathematical, and we forget about that personal interpretation of everything that happens, that is based on our own history. So I think that we need to come back to this humbleness of knowing that we know nothing
that
about
is what
it.
I told before, no, when I said um, that the competence to listen.
I know. Yeah,
You
that's
know,
very
and
important.
the competence to listen means that I have learned to listen to my pains, my afraidness, my believing, and that I put this away and I look the other person with this simple uh, knowledge. I know nothing from you. From ourselves, only little point of iceberg, no? And for the other, forgot, no? Okay. I can only show me the body, and I know which feeling in the base of this process is behind. But what the person and how the person do, I don't know. I can only humbly investigate it. Also there in the way that the person is willing to.
Yeah.
Because the most person, they want only the comfort zone, give me the magic pill, and ciao, no?
Yeah.
And so it's a sadness. It's a 36 years of sadness. But I see how it managed this so pure millimetric map, how it has bring people to, and then they say, you are healing, you are healing. Yeah, when you make recidivate, you die. You're not healing. Yeah, you have symptoms when you are in healing phase, but in the repairing phase. But that doesn't mean that you're going out. No? That's why we need really get awake. No? And we have here an instrument who is millimetric, but if the instrument is millimetric, also our responsibility is exponential, much, much higher. No? Okay, and this is all the tissue which are directed by each part, and okay, and this is the third law, no? And this knowledge that for the new brain it's reducing from cortex and medulla, and from the old brain, parencephalon, brainstem, and cellular, all what when in active phase I put more function, no, more function, and slowly grows cell to help this more function. And when it's in solution, then it can turn in. How do you say pus in English?
Pus.
Plus,
Pus. Okay.
yeah,
Every time when you have pus, you have grown and made the caseous reduction. No, okay. This is really the biggest things. No, okay. So I will stop here because yeah, it was too much.
Your
better.
brain now is fried.
No. I can go on, but I think we should that make slowly. No, maybe another time we make another step, and then we don't talk about all the politics, but we talk about the facts, and then maybe a third step where we talk a little bit about what we do with this knowledge.
Yeah.
So,
Yeah. And it's, it's nice though, Mark, to talk with you because you worked with Dr. Hamer. You're able to read the CT scans, and I think people that are so focused on just the CT scans are missing the bigger picture. There are a lot of people that want to see data, they want to see the double blinds, with what our father did. If nothing else, it's replicable, it's repeatable. And in the end, Dad got results, which is great, but for people to throw out Dr. Hamer totally just because they don't believe the CT scans, things like this are a little ridiculous. And you said the CT scans are just one of 103 different diagnostics.
element, one of 103 elements you can check.
Right.
For
Okay.
each process. For each process.
So if nothing else, the idea here of Dr. Hamer observing people, real people, over long periods of time, seeing connections with things that went on with trauma and how they responded, and then physical reactions. To me, that's it. There's a foundation, a simple basis here. And I'm not going to get stuck in rabbit holes. And in the end of this, I think you're right. These approaches require a broad range. You need to know some anatomy. You need to understand the psychology and the emotional experience. We're more than just, Anna, like you would say, biochemistry. Fear, you talked about, is an important part of what goes on with us. And even the idea of practitioners talking to people and instilling fear subconsciously is a problem. So the idea too, we get stuck in these loops. And if you get a practitioner that gives you the fear, and then as humans, we hold on to these things. So I think this has been really nice. You've given us a good overview. You've answered some questions for me, and you've given me what I need as far as the connections. All right. I think understanding this whole overview is what we all need to do. Look at ourselves and our friends and our family and the world more holistically. There's more than just what you see there. The guru is very interesting too when you talked about that. When Josh and I work with people, they looked at dad like he was their hero. And one of the things he would say is, you needed to understand, you needed to do your part. This is not dad fixing people. So I think with what Hamer did too, and Anna, you'll agree, is it gives us some power. Things will
Because
happen.
I tell you,
Tell me.
I came to knowledge of this system in 89, and 3 weeks after I was 800 kilometers to go to a course of biological law. That I saw Hamer only in 93 personally, but in these 4 years, each uh, question he made at the students, I check. Okay. Because I really understand that there is a system, there is a marriage system. But I took 9 years before I made my first course to explain it. Because before I needed to verify, is it true? Here we don't talk about peanuts, we talk about life and death. And this was my purpose. No? And in 98, I made my first course, and there I was talking about what Hamer said. Okay. Today, when I'm making a lesson, sometimes a student does a question, and they say, this I don't know. Hamer says that I have not verified. All the rest, I tell you, I have verified, and I was a little bit also further, no, in precision. I have all my third wife was a practitioner from Argentina, and she helped me also to get more in details of histologic and anatomic, etc. And today, there's many things who Hamer said, which they're more precision, no? Okay. But the fact is that I have what you told you, what you was telling, no? That is, I take over and give it away, no? But I verified, and today I can say, this I have seen, this not. But this what I've seen, I can tell you it's like that. And I give you the instrument to verify. Because another thing which is very important, and we always say it in the school, it's prohibited,
Prohibited, yeah.
prohibited to believe me.
Yeah, interesting.
You have to talk the instrument and go and verify everything,
Yeah.
and then it goes down the fear. When I have verified. No? Okay.
Right. Yeah.
Okay.
Good. Awesome. Really, really grateful, Mark. And there may be more questions. Maybe we'll email you some questions, or maybe we'll have you come back. Would be great. No pressure. But in the end, are there mysteries when you look at the body? They're all a little bit of a mystery, but when you see things this way, things make sense, don't they?
Sure.
Yeah.
No?
And in the end, your message, the message of peace, the idea that we can look at this in a certain way and understand it, and there's less fear, and then we can start to move through our things and let go of stuff. And
Yeah, to put to find new strategy which are more in harmony with ourselves. No?
nice, yes, and we can navigate this crazy world of ours, right? And smile about it. Damn it! All right. Well, cool. Mark, this has been awesome. You have a book. It's only in German and Spanish. Is that correct at the moment?
No, Yeah, German, Spanish, and Italian. Yeah, it's this book.
Italian.
Yeah,
Okay. All right. The five
but
lays
listen,
lays.
I I bet you a little bit of patience. I have made this, and I was just thinking this morning, you know, the universe and the cycles, no? I wanted to come out with this second version in Italian, the second version, which is written completely different, but with more material and so. And I finished that and so, and it will be published in Italian the 14th of January.
Nice.
12 years ago, the 14th of January, it came out my first version of it.
Wow.
Nice. So now in the university, we have our own publishing house. So we will be very glad to help you to translate that into English. And if you even want to.
I know I'm very old, and but I have now the idea to make my translation with AI.
Yes.
Yeah,
Okay.
okay. Yeah,
And
we can
no,
help you with that,
wait,
Mark.
when it's done, then I ask somebody who is speak
Native.
very well English, no, and knows or Spanish or Italian or so that, or very well Spanish, and then we read together,
Yeah.
and so I adjust the little things. No, this I will
Yes.
surely need. Yeah. Okay.
And then
So count on us,
and then
Mark.
we can do the course. So we'll do the reading club with you, and we'll read with you and ask questions. And awesome. So people be ready for that. We'll tell you more about that coming up. No, really good, Mark. It's so guys.
In the moment is not the school is. I will make school only in Spanish and in Italian because I'm human, no? Okay.
Yes, yes,
But the idea is to have the books in now we are program of 9 languages, different languages, no, and so that it will be
we're getting there slowly but surely. But this was a great introduction.
okay.
And for any of you
Thank
who
you.
speak Spanish and Italian, go buy his book. Yes,
Yeah.
really, thank you, really, Mark. You know, for us with Josh and I, we like to introduce people to the people that we've met, and it's really nice to meet you and have you as a resource so we can reach out if we have other questions for you. Yeah, for
And
those.
I'm also very glad for all the people was here tonight to listen. So they have uh, accepted my poor English.
Yeah, it's done well. It's done well. And that too, for people that are watching and listening, thank you guys for coming and joining us. We will sound out an email and you'll get a link for the replay, which is awesome. You can come join us at our School of Health where we have more people like Mark around asking questions and having conversations. And it's about the discussions, guys. All right. Oh, Andy, I see your name there. It's about the discussions, right? For us to get together and be able to put some things on the table and find some things in common is a great experience. And I don't think, Mark, many people are having discussions these days. A lot of people are just talking at each other. So really, really nice to have you here. Anna, thank you for the support and helping with the translation.
And I'm also glad. that Alejandro is working now with Anna, and and then
Yeah.
be there because we have certain dreams in the Mexico University.
Yes,
Nice.
I just pinned Alejandro. Hola, Alejandro. This is the man that introduced Anna to Mark. So without
Yeah.
Alejandro, we wouldn't be doing this today.
I don't see him now. I don't know where are you pinning the things, but I don't see him. But anyways, yes, we are doing this 5 biological laws course. We do the introduction, and then we will do other cerebral constellations and how to apply that to psychiatry, which is something really important, because I think that the psychiatry is kind of messy in our medicine.
Kind of.
So yeah, we're very, very glad to expand this knowledge, and especially from that position of humbleness, of not rigidity, not dogmatism, but just sharing what we know and sharing what has been found repeatedly, and yeah, putting that at the service of people. This is what we really want.
Yes, and we will figure out some answers together.
Yes.
Well, I want to jump in real quick before we
Oh,
go to Adam and just
Josh.
say, yes, thank you. Thank you, Mark. I think it's really important these days when we're seeing so many of the greats and their name is being taken in a different direction. We see in the United States, a lot of the Waldorf schools don't even talk about Rudolf Steiner anymore. We see this great man like Hamer and what some people are doing with his name, and some of it's just their own incorrect interpretations of what's going on. Our family's been looking at the blood live for over 40 years now, and we see what's going on in the dark field community is utter garbage most of the time. So part of what we're trying to do is make sure some of the greats before us, my father, people like Hammer, the Béchamps, Lamarcks, their names aren't forgotten. And we want their names to be remembered in a way that's, like you said, there's no fear involved. Right. So it's very important for us to hear these things from you, Mark, for somebody who's worked with Hammer, so we can make sure that the greatness of him is not forgotten.
Yes.
Thank you.
Amen.
Well said, Josh. Amen. All right. Well, with that being said, guys, thank all of you for being here. We'll send you the link and digest the information and see what comes up. All right. And get your joy because, damn it, it's important for your health. All right. So have a great day and a great evening, and we'll see you guys all ideally soon. Hasta luego.
Hasta luego. Bye. Thank you.
Adiós. Chao, chao, chao.